Hi guys, this is Untitled back with another video with focus on tips on answering exam questions. Please review our study strategy video. Link will be in the description box. Key fundamentals of good test taking. The key fundamentals of good test taking are just important actions you need to perform prior to your examination. Following a good study of the content, use of practice questions is an effective method of expanding your knowledge and acclimating to the nature of test questions. Why are review questions or practice questions important? They are important for the following reasons. Fills gaps in knowledge. Acclimates the student to testing situation. Sharpens contrast, that is, differentiating disease process, as well as helps ground knowledge on developing differentials. Shows the student's weak areas. Refines the student's ability to recognize patterns, such as pathophysiology and physical findings, and also helps the student to learn how to correlate both concepts. Key fundamentals of good test taking continued. Prior to your exam, ensure that you are well rested and make sure to have a healthy breakfast. Do not study close to the exam time, as this will make you paranoid and nervous. Concentrate on staying calm. You can listen to light music if you're driving, or pray if you're a person of faith. At this point, it is okay to mentally review content you have mastered during your study session. This might be a good time to also review your mind maps. See link in the description box. Once you've gone through providing info to start the exam process, mentally affirm to yourself that you will be successful. Do not think negatively and do not entertain any negative thoughts. Just say to yourself, I can do this and I will pass. Step 1 on answering questions. Review the questions. Devote 1.2 minutes, that is 60 to 72 seconds, to reading the questions carefully. Practice reading through the questions for about half a minute. Then utilize the rest of the minute to go through the question stem and answer choices. Step 2. Once you have a firm understanding of the question stem, pay attention to keywords or adjectives such as most likely, most appropriate, least likely, most accurate, least accurate, which is not, etc. These keywords basically mean you must select the best answer out of the answer choices. You may choose to reword or summarize the question stem for further understanding. Step 3. For case questions, pay particular attention to age, demographic, clinical site, clinical picture. These provide useful clues to answering questions. Step 4. Proceed with your answer choice by surveying or going through the answer choices. Eliminate partially correct answers. If left with 2 likely answer choice, then choose the answer that best connects with the question. This will involve an educated guesswork. Another equally good method is formulating the answer by memory without looking at the answer choice. If the answer choice matches your formulated answer, then that's the correct answer. Step 5. The best method to ensure accuracy in answering questions entails having good grasp of the study content, the study material, or the tested material. For instance, during your studies, pay close attention to the most common disorders within your field of practice. Furthermore, pay very close attention to hallmarks, red flags, atypical presentation common within the patient demographics, best initials / appropriate diagnostics, and so forth. Step 6. Do not spend too much time on difficult questions. Make an educated guess and then come back to the question. At times, the answer to your difficult questions lies in another test question, so learn from your test. This happened to me during the boards. Components of a good question or a case vignette: patient demographics, clinical sites, relevant risk factors, relevant historical data and physical signs and other findings or symptoms, relevant laboratory studies and imaging, relevant treatment and management principles, caveats of management and monitoring specifics. This is not a conclusive list. This is just a guideline. Example of a question stem. This is a long question. Mr. Abathy is a 57-year-old Caucasian male with a history of anterior wall MI and stage 1 hypertension, presenting with chief complaints of irritative voiding symptoms or dysuria. Patient reports weak urine flow, nocturia, prolonged voiding, and slight discomfort and straining during voids. Urinalysis is negative for nitrites, leukocyte esterase, and microscopic hematuria. AUA-SI index is greater than 10, which implies that patient has moderate BPH. Current drug regimen include carvedilol, Plavix, low-dose aspirin, lisinopril, and high-intensity statin. Which of the following medication would be most appropriate to add to his regimen? A. Prazosin. B. Tamsulosin. C. Finasteride. D. Oxybutynin. The best answer choice is Tamsulosin. Why did I pick Tamsulosin? The question is alluding to the fact that the patient has moderate BPH based on his symptomatology or symptom profile. The reason I was able to come up with the answer is based on my knowledge of BPH. Tamsulosin is the best initial therapy for BPH. This is because it is uroselective and has minimal hemodynamic effect. It causes the relaxation of the bladder neck and prostatic urethra and prostate smooth muscles. Also, evidence has demonstrated that it has superiority in relieving symptoms. Prazosin is not recommended because it has limited scientific evidence. Finasteride is used when there is a documented enlargement. In my view, the other medications have applicability to other disorders, but it has no significance to the narrative of the question. Oxybutynin is used for hyperactive bladder. So that's how I came up with my answer. Here is another example of a question stem. Mrs. Young is a 56-year-old female recently seen in your clinic with heart failure. On follow-up visit, she reported feeling fatigued, dizzy, GI disturbances, and previous syncopal episode. Further evaluation revealed depressed respiratory rate and rhythm, cold, clammy skin. You suspect that the patient is in severe hypertension. Which of the following medication is likely to cause this presentation? Which of the following medication is likely to cause this presentation is the question stem. Answer choice include the following: A. Losartan. B. Amlodipine. C. Digoxin. D. Verapamil. E. Eplerenone. The best answer choice is Losartan. Why is Losartan the best answer choice? Based on my knowledge of cardiac pharmacotherapy and mechanism of action of cardiac drugs listed in the answer choice, use of ACE and ARBs can cause hypertension that present as a first dose phenomenon or any time during the course of chronic therapy. Digoxin reduces heart rate by increasing systolic blood pressure, but have been found to decrease diastolic pressure in some population subset. Amlodipine can cause hypotension. Amlodipine is a calcium channel blocker. Verapamil can cause severe hypotension in combination therapy. They are classified as non-dihydropyridine calcium channel blockers. They block the AV node, decrease heart rate, and decrease cardiac contraction, but still has some vasodilation effect. Eplerenone is considered a potassium-sparing diuretic similar to spironolactone. It works by blocking aldosterone to lower blood pressure, and it has a low side effect profile. So based on my knowledge of all these antihypertensive, the best answer is losartan. Also, centrally acting alpha blockers are also known to cause first dose hypertension. Another example of a question SNP. A 50-year-old patient who's currently a smoker is inquiring about screening for abdominal aortic aneurysm, AAA. What is the optimal strategy for screening for presence of AAA per USPSTF recommendation? A one-time ultrasonographic screen for current and former smokers age 65 to 75. B, a 4-year interval of ultrasound screening for current and former smokers age 40 to 80. C, a one-time chest radiograph for current and former smokers age 55 to 75. D, a one-time low-dose CT for individuals age 55 to 80 currently smoking with a 20-pack year smoking history, or smokers who have recently quit smoking greater than 15 years. Answer A is the right answer choice. Why is A the right answer choice? Because it has a grade B recommendation and it is evidentially sound. To be able to answer this question, this is a question STEM, you must know the USPSTF screening recommendations and commit it to memory. The other answer choices are incorrect. D is for smokers age 50 to 80 and not 55 to 80. So this patient will also benefit from the screening intervals recommended for smokers by USPSTF. Step 7. This is just an additional step to help you out as a student. Join our platform on Facebook and Instagram. Our platform on Instagram is Medicine for APPs. We have exclusive content on learning, review questions on different areas of medicine. Thank you so much for watching the videos. Please like and share our videos, and thank you so much for your support.